about accessibility to services. Now, let's come to the one where you and I belong to quite significantly, because we work within the framework of the NSP on HIV and STIs, and we know that there are other health issues that come into being. So now, can we talk a little bit about the right to health, what it really does to us?
It means a lot, because health is life, actually. Some they even say health is wealth, but when we talk of health, we talk of services that I need to access. So when it comes to health, actually, we need to ensure that services are always available. We need to ensure we take care of it.
Accessibility is important.
Okay. If then it's not available, then how am I going to access it? And when I come to finding it available, then it should be accessible. So if it's accessible, then that means I can be able to get into that place and get a service available. Yeah. But now, for me getting to that service, then it goes further again to say, if I get that particular service, am I accepting it as the way it's given to me? So it needs to be also acceptable. So when I accept the service, and then now it comes to the part that is very important: is it of good quality or not? So if then it's not of good quality, you can have it might be available, it might be accessible, it might be also acceptable. But if it's not of good quality, then
it's not going to help.
It's a problem. Okay. It might be of a good quality, but it's not accessible. So these are very much important.
So these milestones are quite important. Very much that they are there. First, it needs to be available.
Indeed. Okay. It must be available.
And then, if it's not accessible, it's not helpful.
It's not.
Okay.
Then
even if it's acceptable, it needs to be acceptable.
Exactly.
Okay. So now it goes with the responsibility of making sure that acceptability is there. Okay. But again, as you say, then we're looking at the quality as well. So it's quite complex.
Very much complex.
The right to health.
Very much complex.
And how we can link
there are huge gaps. Because if it was of good quality, accessible, available, and acceptable, I don't think we would be having all these issues that we are talking about. If then it was of good quality, we wouldn't talk about stigma discrimination. If it would be acceptable, we wouldn't be talking of teenage pregnancies and all of that. Because if then I can be able to get those services, as I've mentioned, then for me, I don't think we'll be dumping kids in rivers. I don't think some of these, because as much as we're talking of health,
could be avoided.
Indeed. As much as we are talking of health, there are also other departments that are also involved. When we talk of health, now one child is raped. Department of Health needs to ensure that they provide the services. They do all this work, ensuring that the hearing is filled. That's a legal report now. But now, remember, when that process is taking its course, the legal component of it, it's not kicked in yet. But already they are preparing the process to say when now the legal part comes in, and then systems are in place. We've got reports. Now, that's the accessibility we're talking about, but look at the condition and the situation, it's different. Now, a person who's just feeling a headache, who's vomiting, because now it's fever season, goes to the facility, wouldn't get such attention. Because yes, it is health related, but the criticalness of it, it's different. Yeah. And again, even though the person is assessing that in that particular facility, the quality of that service is totally different again.
Yeah.
So it's like we
but
wait
it's
for.
Not less important.
It's not less important.
Yeah, because it's still dealing with the life.
Indeed. So now it's like we wait for the critical part of things to provide good quality of services. And even if we're providing those good quality of services, there are also gaps amongst those services. So you'll find that you wait long there are time frames that are given facilities, 2 to 3 hours or 2 hours 30 minutes. But
especially with men when it comes to accessing services, they tend to not to be unfair on them, but not appreciate enough to be able to access those, because if you're working and you're going to be queuing at the facility, that's the
a lot. So again, like I'm saying, our systems, we need to relook at them. Look at how these things are. Because, for instance, you used to be servicing 5 patients a day, but now you are receiving 20, and you're still having a 2-room facility. How are you going to be coping with it? Even if you can bring 10 nurses, but a 2-room facility,
but it's not
providing the service. So those are the things that you need to look into. A health, what you call right, is very sensitive. It's more of a center. Again, like I've mentioned earlier, exactly. We're talking of life, so life must be taken care of, regardless of the situation. We need to ensure life is safe. So if those are not looked into, then we find ourselves in situations where now we are talking about it. To say, but how are we looking at this? Because these things are available. If then they are available, but it's not accessible, it's not acceptable, it's not of good quality.
And
what we do,
just sit on the surface.
Exactly, my
quality is not it.
It's not
like
there.
you just tick the box.
You tick the box, and you're ticking a box on someone's life.
Yeah.
So you see the risk you're taking there. So it's not just a compliance matter, but it's also back in your mind to know that I'm dealing with someone's life, someone's mother, someone's breadwinner. All that must come into play while we are providing that.